Well, the goal of the Tu Apoyo is to bring hope to the Latinx communities in South Carolina. These are difficult times. Everyone at some point can benefit from seeking assistance. Our Latinx communities, they're very resilient, and they have strength. And we find a way to push forward to make it. The pandemic has shown the disparities, but it has also shown how we come together as a community to assist and support one another. So that Tu Apoyo line is available for the community, for the Latinx community to hold their hand through these difficult times with COVID and other concerns they may have. We're here to listen. We're here to provide community resources that they might not have access to. Many Latinx immigrant communities don't have access to the internet, don't have access to smartphones. Many live in South Carolina, many live in rural areas. And having this toll-free number that is available to them in Spanish, in their language of preference, not having to ask for an interpreter when they call. It's very important. The effects of the pandemic have hit Latinx communities hard. I mean, both physically and emotionally. It has also shed a light on the disparities faced by marginalized communities and people of color. To be a little more specific, Latinx immigrant communities were facing a lot of stress prior to COVID. For those immigrant communities, things that were already difficult are 100% more difficult now. There's a lot of worry in the community, more reports of anxiety and emotional distress. Latinx immigrants are not only worried about the COVID-19 situation in the US, but also in their countries of origin. Many immigrant Latinos have families back in their country, families they worry about, and families that they have to financially support. Recent US Census Bureau data shows that from May 28th to June 2nd, feelings of not being able to stop or control worrying were as high as 63% among Latinos. Many Latinx immigrants do not seek mental health treatment for the fear of being labeled loco, right? That's a word, that's a Spanish word for crazy. And some don't have the means to access appropriate services to adequately manage their mental health needs. Also, the dynamic of a Latinx family is usually extreme closeness, and the fear of bringing shame to their family or making their family feel as if they caused a mental health illness may prevent individuals from seeking mental health treatment. For monolingual individuals, the lack of access to providers that can provide the services in their preferred language or native language creates an additional barrier to seeking treatment. Also, their past experience with the healthcare system or mental health services can cause a barrier or a stigma to seeking mental health services, because if they had a negative experience, then they're going to link that experience for future services.